Hi everyone, I'm Alex Lovato. I'm one of the assistant athletic trainers here at the University of Toledo. I'm here with Dr. Erica Martin. She's a sports care and family physician through Promedica. She's also one of our team physicians here with Toledo Athletics. Today we want to talk about just a few of the myths, facts, and fiction that you may or may not have heard through different media sources regarding the coronavirus, also known as COVID-19. Dr. Martin's here to help work through some of those common questions that you may or may not have, and also debunk some myths that you may or may not have heard. Our first question is, how can someone evaluate their own symptoms and determine if they are experiencing something such as seasonal allergies, a common cold, or if it warrants a further exam for the coronavirus, especially given that we are entering allergy season as the weather starts to brighten up, sun's out more.
Yeah, so this is an excellent question, and it's a question I'm getting quite a bit. So I'm glad you're asking. Um, so you're right. Some of these symptoms that are related to coronavirus are definitely, have some overlap with seasonal allergies. And so, I think one of the more obvious things is, if this person or if you have a history of seasonal allergies in the past, like typically around this time of year when everything's finally blooming and it's getting warm, if you start to get kind of sniffly and have a little bit of a dry cough, that's one thing. But then kind of in differentiating between the two, I think the biggest thing is that with COVID-19, patients will typically have a fever, which a fever is defined as a temperature of 100.4 degrees Fahrenheit or higher. Another thing too is a cough. Typically with COVID-19, it is a dry cough, but coupled with shortness of breath. So with allergies, definitely you can have a dry cough, but never really with allergies are you going to have a fever. And typically people aren't going to become short of breath unless they have, some underlying asthma as well. And then with COVID-19 as well, patients typically will have symptoms similar to the kind of more common flu that we're used to dealing with. So, severe headache, severe body aches as well. And then COVID-19 patients can also have issues with diarrhea and nausea and vomiting. And certainly those symptoms are not typical with allergies. So excellent question.
I think that does a great job of explaining the difference and probably help diffusing some of the fear with your seasonal allergies as it starts to get nicer out. Um, Moving on, we've had a lot of talk about different things opening up, depending state by state, and with current social distancing rules and the potential for a leniency perhaps with the shelter-in-place orders. How should people interpret that? Is it best to stay indoors, continue to stay inside, or are there certain outdoor or leaving the house activities that are permissible?
Yeah, another great question because I'm seeing a lot of my patients kind of doing the Netflix and sheltering in place at home, so not really wanting to get outside because they think there's a lot of concern in the community that even taking a walk out in your neighborhood or in your neighborhood park is harmful or could be harmful. And so I think this is a really big myth to dispel. So definitely it is okay to go outside, take some laps around your yard, take some laps even around your neighborhood. The most important thing with the social distancing concept is just making sure that you're staying within a 6 foot range of other people that you're walking or running or biking around. Because it's that 6 feet radius that we think is like kind of the furthest that coronavirus can travel in airborne particles if someone were to cough or sneeze or talk or that sort of thing. So definitely I would encourage people to get outside with the nice weather coming up, and just being outside helps us feel a little bit better, just in general helps lift our spirits. And then exercise is super important. I'm pretty sure we're going to talk about that, but it's really important. So yeah, just maintaining a 6 feet radius, foot radius around those around you is most important. And when you're going to the grocery store, going to the pharmacy, which you can also definitely do, but just maybe limit those visits. Again, making sure you're within a 6 foot radius of of those around you, and then also wear a cloth mask, which I think we'll address that a little bit further in the coming questions too.
Awesome. With regards to social distancing, say you do decide to go out on a walk and you encounter your neighbor and you might have a conversation that's within the 6 feet range just out of habit or not, um, noticing that, remember those 6 feet guidelines, and you later find out that that individual tested positive for COVID-19. How long after that exposure should someone be concerned?
So this kind of varies depending on how you talk to, and honestly, we're still learning, as I'm sure you know, we're still learning a lot about coronavirus at this point. But I think the general consensus at this point is that the incubation period, which means basically the time from exposure to onset of symptoms with coronavirus, is anywhere between 2 and 14 days, which I recognize is a really big range. But I think many studies more recently are showing around 5 to 7 days. So not the end of the world, no reason to panic. And frankly, given how pervasive coronavirus is likely in the community, we've probably all been exposed at some point, but we're not having symptoms. So just monitor yourself again for those symptoms that we talked about when we were talking about allergies. Because again, if you're within that 6 foot radius, you're probably going to be okay anyways. But again, just self-monitoring for fever, shortness of breath, dry cough, body aches, and everything should be okay.
So another myth we're seeing, and or myth or perhaps fact, there's a controversy between wearing a face mask, wearing gloves when you're out in public when you have to make those grocery store runs. Are these forms of protection going to keep the uninfected safe?
Another good question. So first of all, and I should have prefaced our conversation with this actually, most up-to-date and accurate information regarding coronavirus and these kinds of questions that you're asking me, especially about masking and general personal protective equipment, or PPE, as we've probably all heard of at this point. CDC.gov, that website is fabulous for answering many of these questions, and again, offers not so much of an alarmist view on things as maybe some of our media outlets. So plug there. But so there have been quite a few studies looking at the efficacy or how well our personal protective equipment works with regard to coronavirus. And so the general consensus at this point is that those who are venturing out to a more confined space, so basically in my mind, that means if you're going to a store, if you're, I guess going to the store would be the most applicable kind of example. But if you're going to the store, again, 6 feet distance away from those around you, and then wearing some sort of mask. And so it is not recommended that people purchase medical grade masks. The reason for that is that we need those for our healthcare providers still. So the recommendation at this point is that you can actually use a bandana, you can use a scarf, and you can also fashion your own cloth mask at home as well. And actually on that website, I described the cdc.gov. There are actually some good patterns for face masks. So either if you want to sew one of your own, or actually there was a method of producing your own scarf or mask with a bandana and a couple of hair elastics as well on that website. So both of those are really helpful. And I know a lot of people in the community are making these masks too. I think you can buy a lot of them online too. So that's one. As far as the gloves are concerned, even in the healthcare setting, if we are not anticipating that we're going to be in contact with body fluids from the patient, so body fluid, most commonly referring to saliva, so spit, or mucus, or for lack of a better term, snot. So if I'm not going to be looking in somebody's mouth, if I'm, not worried I'm going to come in contact with, blood, urine, stool samples, nothing like that, then I don't have to wear gloves seeing a patient. So certainly someone in the community, they don't need to be wearing gloves either. And again, that's part of personal protective equipment that we really need to protect for our healthcare providers who are on the front lines. So So no, you don't need gloves unless you're anticipating, sticking your hand in somebody's mouth on the grocery line. So, so the most important thing is, and we'll talk about this too, but if you're touching things, at the store, you're getting gas, make sure that you're cleaning your hands appropriately after that contact.
Yes, that kind of leads me into my next question. There's this push that you should be washing your hands after every encounter or using hand sanitizer, which you and I could probably agree that we should be doing that also not during a pandemic. Um, but is there a difference in efficacy between hand sanitizer and your traditional soap and water?
So I think that there is a little bit of debate about this. I was kind of reading up on this before we were chatting, and it sounds to me like whenever available or whenever it's kind of convenient for you, ideally you're washing your hands with soap and water. Um, and the kind of it's not like the 2-year-old washing their hands, 2 seconds and we're done. We're talking 20 seconds that you should be really vigorously rubbing the hands together, making sure you're getting in between your fingers, making sure you're getting both the fronts and the backs of your hands. So being very thorough with that. And that is quite effective, and definitely, if your hands are visibly soiled after you're whatever, pumping gas or, going to the grocery store, or whatever, then definitely you should be washing your hands with soap and water. However, again, that's not always convenient. So, once you get in your car after you've pumped your gas or, back from the drugstore, getting in your car using some hand sanitizer is just fine as well. Ideally, it should be around at least 60% alcohol based for it to be effective. So yeah, hand sanitizer is great, but prioritizing hand washing first and foremost is important. Sorry about that. And also making sure that as much as possible, you're not touching your face or around your mouth. I know it's really difficult, but just being cognizant of that as well. So
I think one of the biggest questions that our athletes are going to have moving forward, now that we see how easily germs and viruses, bacteria can be transferred from one person to another, um, how can we best prepare our bodies and our immune systems to tackle these illnesses? Not only the COVID-19 virus, but just your common germs as we move forward into the next school year and start to resume somewhat of a normal life here in the coming months.
yep. So this is a really good question because it lets me talk about some really important aspects of really self-care, I think. So, for one, I think we all tend to maybe think about, watching our diet and exercising as things that we do to kind of look good and feel good right in the moment, right? But we don't think about the fact that actually, moderate amounts of exercise and eating a well-rounded diet, meaning lots of fruits and vegetables, is really important for our immunity as well. So that would be one thing. So making sure you're consuming plenty of fruits and vegetables, hydrating well with water, and then exercising regularly, which I know is not going to be a problem for our athletes. But making sure that those two pillars are in place is super important. And then another kind of unsung hero in my mind, especially for student athletes and for college students in general, is sleep. So sleep is so important for our immune system and our immune response. And again, our overall well-being and how we kind of view life and how we feel in our bodies. And so, ideally trying to get 7 to 8 hours of good restorative sleep is incredibly important, not only for your immune system, but again, how you feel about life, and then also how you perform on the field and in the classroom. And then, another thing that I think is really important too is managing our stress. And I know we talk a lot about this, and it seems like it's kind of an impossible thing to mitigate, but doing some sort of stress relief activity, for people who aren't athletes, exercise is obviously one of those, but even doing some kind of guided meditation or just something to kind of get you in the moment is really important as well. And there have been some really good studies looking at meditation and mindfulness and immune response that have been very positive. So all things that we should be doing already, but maybe we, don't always make time for. So,
I think that's great advice for both our student athletes, but also our coaches and the rest of our staff, and myself included. So thank you very much for that. That wraps up all of the questions that I hope to have answered. Is there anything that you'd like to add before we wrap up today?
I don't think so. I mean, I think that the most important thing for us to kind of take away from all of this craziness and kind of disruption of our lives is, maybe this has been an opportunity for us to evaluate what's most important for us, and our priorities certainly. But also, I think another thing to think about too is, as I kind of alluded to, the media is all over the coverage of coronavirus, and sometimes that can get a little bit overwhelming. So, taking some time to step away from that every day, I think is super important for our well-being. So,
I agree. Well, thank you so very much.
you're welcome. Thank you.